So welcome to our discussion on the acid-base imbalance. Before we are going to discuss fluid therapy, let us first have an introduction of the theories of the acid and the base imbalance. So it is said that the acid-base balance is fundamental to physiologic homeostasis. It refers to the way in which the body maintains a relatively constant pH despite continuous production of metabolic end products. Animal disease states lead to abnormalities of body fluid, electrolytes, and acid-base balance. The ability to interpret acid-base data enables the practitioner to identify the cause of the imbalance and provide appropriate treatment. As a review of the key terms, so when we say acid, these are substances that can donate hydrogen ions. On the other hand, when we say base, these are substances that can accept hydrogen ions. So what are examples of acids? So when we say acids, examples of these are hydrochloric acid, nitric acid, ammonium, lactic acid, acetic acid, and carbonic acid or H2CO3. Examples of bases are ammonia, lactate, acetate, and bicarbonate or HCO3. So the pH is used as a measure of the acidity of a solution, or it is also used to express the concentration of hydrogen ions in a solution. This diagram shows the relationship between hydrogen ion concentrations of a solution and its pH. So pH is defined as the negative logarithm of the hydrogen ion concentration. So the ratio of the hydrogen ions and the pH is considered to be inverse, meaning that the higher the hydrogen ion concentration, the lower the pH. The lower the hydrogen ion concentration, the higher the pH. So for example, when we are going to compare the hydrogen ion concentration of a pH 1 compared to a pH of 9, so the hydrogen ion concentration in the pH 1 is considered to be higher compared to that of the hydrogen ion concentration in a pH of 9. So as you can see here in a pH scale, the pH 7 is considered to be neutral. So below that, the solution would be acidic. Beyond that, or higher than 7, the solution would be basic or alkaline. So when we are going to move from a 7 towards pH of 1 or 0, the concentration of the hydrogen ions would also increase, while when we are going to move from a pH of 7 to a pH of 14, so the solution would have an increasing basicity, and it will also correspond to a decrease in the concentration of the hydrogen ion concentration. This diagram shows the pH of our arterial blood. So we have here our pH scale showing the normal pH range of the blood, and it is said that the blood is slightly alkaline. For normal enzyme, cell function, and metabolism, the pH must remain within a narrow range. That range is between 7.35 and 7.45. It is said that even a slight decrease or increase or even a slight change in the pH of the blood, it would result into a devastating effect onto the animal. When the pH goes beyond 7.35, there will be the development of alkalosis. When the pH goes below 7.35, there will be acidosis. So as you can see here, when the pH goes below 7.35 towards the left of our scale, so there will be acidosis. When it would go towards the right of our scale, or when there is an increase in the pH of the blood, there would be alkalosis. So why this is important? because uh, a blood pH, for example, below 6.8 or above 7.8 is considered to be fatal to the animal, and it can result to death. The acidity of a solution is measured in its hydrogen ion concentration. But where are these hydrogen ions come from? So one of the sources of the hydrogen ion is the carbonic acid, and the major source of hydrogen ions that will eventually form carbonic acid is the carbon dioxide. We also have another example of the source of hydrogen ions are the inorganic acids produced during nutrient breakdown. So the dietary proteins contain a large quantity of sulfuric acid and phosphoric acid. Another source of hydrogen ions are the organic acids from intermediary metabolism. So example of this are lactic acid and fatty acids. It is said that the body contains a buffering system that are important to maintain the pH of the body fluids and the blood into normal, within a narrow pH range. In this equation, we have here the buffering system that are important in the maintenance of the normal pH of the blood. So we have here our carbon dioxide, our water, carbonic acid, bicarbonate, and the hydrogen ions. So when this carbon dioxide will combine with water, there will be the formation of carbonic acid, and the carbonic acid will be broken down into bicarbonate and hydrogen ions. So what are the roles of these particular compounds? So the carbon dioxide is considered to be acidic. The hydrogen ion is considered to be acidic, while the bicarbonate is basic. So within in the normal functioning of the body, this compounds here is in equilibrium with this compound here. No? The amount of the carbon dioxide and water must be in equilibrium with that of the bicarbonate and the hydrogen ion concentration. So when the carbon dioxide, for example, in the body will be increased, there will also be an increase in a shift, changes in the compounds that are present on the left side, on the right side of this equation. The same is true when the amount of bicarbonate will be decreased or increased. There will also be a changes in the amount of carbon dioxide that will be present on the left side of this equation. So this equation must again be in equilibrium in order for the body to maintain its normal function and to maintain the normal pH. So in the body, there are mechanisms in order to regulate changes in pH. Here are the three main mechanisms for doing so. So the buffering system, number one is the buffering system, and the main players under these are the bicarbonate, HCO3, and the carbonic acid, H2CO3. When we have an increase in the hydrogen ions, what will happen is the hydrogen ions will attach to bicarbonate in order to form carbonic acid. When we have a reduced hydrogen ions, what will happen is the bicarbonate, or rather the carbonic acid, will dissociate into bicarbonate and hydrogen ions in order to supply the reduced hydrogen ions. Another compensatory mechanism to regulate body pH is the respiratory compensation. So the lungs will work by regulating the carbon dioxide in the body. So for example, when there is an increase in the concentration of carbon dioxide in the body, the lungs will tend to compensate by increasing breathing in order to excrete or exhale carbon dioxide. We also have the renal compensatory mechanism, that is through the bicarbonate. So the kidney will work by regulating the bicarbonate in the body. When we are going to compare respiratory compensation and renal compensation, the respiratory compensation works faster compared to the renal compensation. So we are still here now on our equation. So we have here carbon dioxide, water, carbonic acid, hydrogen ions, and the bicarbonate. So when we are going to examine our equation, so this we can see here that on the left side of our equation, this is basically regulated by the lungs because it involves the gas, carbon dioxide. So this is basically regulated by the lungs. And of course, when we are going to examine our bicarbonate, so the bicarbonate is mainly produced and secreted by the kidneys. So the kidneys and the lungs are the two major organs that are involved in the regulation of our buffering system in the body, particularly our bicarbonate, carbonic acid, and our carbon dioxide. When the pH of the blood is decreased, the lungs would tend to compensate by increasing ventilation so that more carbon dioxide is eliminated and the pH increases. So when we say the pH is decreased, so there is acidosis. So when there is acidosis, the lungs will tend to compensate. And that compensation is via the elimination of the carbon dioxide. So as we have discussed earlier, we have said that the carbon dioxide is considered to be acidic. So because carbon dioxide is acidic, so when there is acidosis, there is a need to eliminate that carbon dioxide. And elimination of that carbon dioxide can be achieved via hyperventilation or increase in ventilation in order to exhale the excess carbon dioxide. In this way, when the carbon dioxide will be eliminated, so the pH will tend to increase and it will go back to normal pH. When the pH is increased, so this means that there is alkalosis, the lungs would tend to compensate by decreasing ventilation so that the carbon dioxide is accumulated and the pH decreases. So again, our carbon dioxide is acidic, so that when there is alkalosis, the lungs will tend to compensate by hypoventilation in order to retain carbon dioxide and decrease the pH into normal. So one of the parameters that is used to determine the presence of respiratory acidosis or alkalosis is through the PCO2 or the partial pressure of arterial carbon dioxide. The partial pressure of the arterial carbon dioxide reflects the level of carbon dioxide in the blood. An increase in the PCO2 level indicates hypoventilation from shallow breathing. So when there is, for example, increase in the concentration of carbon dioxide in the lungs, it would mean that it could be caused by hypoventilation. And that hypoventilation would tend to accumulate carbon dioxide in the respiratory system. So the respiratory system responds within minutes but provides only a temporary compensation. A decrease in the PCO2 level indicates hyperventilation. So when there is a decrease in the concentration of the carbon dioxide in the lungs, it can be caused by hyperventilation. This diagram shows the respiratory regulation of the blood pH. So we have here a comparison between the acidosis and alkalosis and what does the respiratory system do in order to regulate the blood pH or in order to compensate for the changes in the blood pH. So when there is acidosis, what will happen is the brain and the arterial receptors will be stimulated in order for the lungs to increase respiration or increase the respiratory rate. In this way, when there is hyperventilation or increase in the respiratory rate, the carbon dioxide that is present in the lungs will be excreted or exhaled. Then, when there is a decrease in the level of the carbon dioxide in the blood, this would also mean that there will be less carbon dioxide that will combine with water to form carbonic acid. When there is less carbonic acid, this would also mean that there will be less in the hydrogen ion that will be formed. So there will be an increase in the pH because there is a loss of the hydrogen ion. So in this way, the pH of the blood will be restored to normal. On the other hand, when there is alkalosis, so the alkalosis will be a stimuli in order for the brain and the arterial receptors to be stimulated. So when the brain will be stimulated, it will send a signal into the lungs in order to decrease the respiratory rate. When there is a decrease in the respiratory rate, so what will happen is the carbon dioxide will accumulate in the lungs. When there is an accumulation of the carbon dioxide in the lungs, so this would also mean that there will be an increase in the level of carbon dioxide in the blood. An increase in the level of carbon dioxide in the blood will tend to promote the formation of higher level of carbonic acid. So as we have earlier seen in our equation, so the blood or the carbon dioxide will tend to combine with water in order to form this carbonic acid. So when there is an increase in the blood carbon dioxide, so there will be more carbon dioxide that will combine with water to form carbonic acid. So carbonic acid will tend to be broken down into bicarbonate and hydrogen ions. So there will be more hydrogen ions that will be available in the blood. So this will tend to decrease the blood pH to normal. Another important organ that is involved in the regulation of the pH is the kidney. So the kidney regulates the concentration of the bicarbonate and the hydrogen ions in the body. So when the blood is acidic, so when there is acidosis, what will happen is the kidneys will reabsorb bicarbonate and excrete hydrogen ions. As we have earlier seen, when we say hydrogen ions, that is an acidic compound, while bicarbonate is a basic compound. So when there is acidosis, what the kidney will do is it will excrete the acidic compound hydrogen ions in order to compensate for the acidity of the blood. When the blood is alkaline or when there is alkalosis, what will happen is the kidneys will tend to excrete bicarbonate and retain hydrogen ions. So again, bicarbonate is acidic or basic in nature, and hydrogen ion is acidic. So this diagram shows the conservation of bicarbonate in the kidney. So we have here our proximal tubule cell, the bloodstream, and the lumen of the proximal tubule of the renal tubule. So we have here our bicarbonate and our hydrogen ions. So the bicarbonate are formed from the breakdown of the carbonic acid. So this proton here will tend to be co-transported towards the lumen of the proximal tubule, and in the presence of the bicarbonate in the lumen, it will tend to associate with bicarbonate to form carbonic acid. The carbonic acid again will be acted upon by the carbonic anhydrase to form water and the carbon dioxide. The carbon dioxide will go into the cell to form carbonic acid from carbon dioxide and water in the presence of the carbonic anhydrase enzyme. So this mechanism here shows the production of the bicarbonate, and it is said that the proximal tubule is not permeable to bicarbonate, so that it is conserved in the kidney rather than reabsorbed. So let's now proceed to the acid-base disorder. So when we say acid-base disorder, this represents a change in the normal extracellular pH that may result when the renal or the respiratory function is abnormal. This may also result when an excess acid or base overwhelms the excretory capacity. There are two disorders of the acid-base balance, and these include the acidosis and the alkalosis. So when we say acidosis, that is too much acid or not enough base in the blood. When we say alkalosis, that is too much base but too little acid, or too much base or too little acid in the blood. These disturbances are either metabolic or respiratory in origin. The three key pieces of data to consider when assessing acid-base balance and or acid-base disorder are pH, partial pressure of carbon dioxide, and the bicarbonate. The acid-base disorder can be respiratory or metabolic in origin. When we say respiratory, the primary disturbance is in the lungs, particularly in the partial pressure of carbon dioxide levels. It can be respiratory acidosis or alkalosis. When the abnormality is on the kidney, we have a metabolic, so it is a metabolic type. And the primary disturbance is in the bicarbonate levels. So it could be metabolic acidosis or alkalosis. If the respiratory system is responsible, we must look for the partial pressure of carbon dioxide in the arterial blood or serum carbon dioxide. If the metabolic system is responsible, or if it is on the kidney, we must look for the serum level of the bicarbonate. The acid-base disorder can also be mixed or simple. So when we say simple acid-base disorder, the primary disturbance and the expected adaptive or the secondary response is in the opposite system. So for example, when the primary disturbance is on the kidney, the expected adaptive response would be on the lungs, and vice versa. So the simple type of acid-base disorder happens when the compensation is appropriate. How about the mixed acid-base disorder? So this happens when two separate primary disturbances are present in the same individual. So in this particular type of disturbance, the compensation can be inappropriate. These are the examples of the simple acid-base disorders. So we have metabolic acidosis and alkalosis, respiratory acidosis, and respiratory alkalosis. So what is metabolic acidosis? So when we say metabolic acidosis, that is a primary gain in acid or loss of base. So when we say acid, we refer to it as, that is referred to as the hydrogen ion or the proton. When we say base, that is referred to as the bicarbonate. This is considered to be the most common acid-base disorder in veterinary medicine, particularly in dogs, cats, and horses. This diagram will show the patterns that are associated with metabolic acidosis. So in metabolic acidosis, in terms of the pH, there is, of course, a decrease in the pH towards the acidic side. In terms of the hydrogen ion concentration, so again, when we say a decrease in pH, there will be a corresponding increase in the hydrogen ion concentration. The primary disturbance is on the level of the bicarbonate. So since bicarbonate is a base, so the primary disturbance for metabolic acidosis is a decrease in the base or decrease in the bicarbonate. And the secondary response would be to decrease the partial pressure of carbon dioxide through the lungs. So since carbon dioxide is acidic, so it must be eliminated by the lungs, and that this can happen through hyperventilation in order to exhale the excess carbon dioxide in the lungs. So these are the uh, common causes of metabolic acidosis in veterinary medicine. The first is uremia. So uremia can be due to an end-stage kidney failure, and it can lead to the formation of uremic acids. We also have ketosis. So ketosis can lead to the formation of ketones and keto acids. We also have the lactoacidemia that could lead to the buildup of lactic acid in the blood. We also have the ethylene glycol toxicity and the toxicity due to the aspirin or the acetyl salicylic acid. So since these drugs are acidic, so their accumulation in the body will tend to increase the acidity, and it can lead to metabolic acidosis. Or the clinical signs of the metabolic acidosis. So the clinical signs most commonly associated with metabolic acidosis are hyperpnea and CNS depression. So when we say hyperpnea, that is an increased minute ventilation. For the treatment of the metabolic acidosis, so the primary treatment or the initial treatment is geared towards the prompt diagnosis and specific treatment of the underlying disease. So for example, insulin and fluids for diabetes. So diabetes is also one of the disease that could lead to the formation or to the production of the metabolic acidosis. And treatment of the underlying disease of the diabetes requires insulin. The next is to correct the electrolyte imbalance. So for examples of electrolyte imbalance are hypovolemia and dehydration. So fluids can be used in order to correct the electrolyte imbalance. We also have to maintain an efficient kidney function. So of course, the primary disturbance or the primary organ that is involved in the metabolic acidosis is the kidney, because it regulates the bicarbonate and the hydrogen ion concentration. So we must maintain an efficient kidney function and support the kidney perfusion. So another treatment for metabolic acidosis is the administration of crystalloid fluids, particularly the lactated ringer solution. So the lactated ringer solution is fluid therapy that of course contains sodium chloride, sodium lactate, and others. And this is specifically indicated for low blood volume or hypovolemia. We also have the administration of the alkalinizing agents. So since there is acidosis, so alkalinizing agents can be used. Conservative administration of sodium bicarbonate if the pH decreases below 7.1 or 7.2 to avoid cardiovascular complications. So again, one of the effects of the acidosis could be that it could decrease yung cardiac contraction, would lead to heart failure. So to avoid this, these alkalinizing agents can be used. In metabolic alkalosis, so this is characterized by either an excess of the bicarbonate, which is the base, caused by a deficit of hydrogen ions in the blood. So what are the causes of metabolic alkalosis? So one of that is excessive loss of the hydrogen ion, which is an acidic compound. So this is caused by excessive vomiting through GIT obstruction. So one of the compartments in the body that contains hydrogen ion is the stomach. So when there is vomiting, what would happen is hydrogen ions would be lost in the vomitus, and it could lead to the development of metabolic alkalosis. Another is the hyperaldosteronism. So this is a condition wherein the body tends to produce too much aldosterone. And aldosterone, one of the functions of the aldosterone is to promote the excretion of the hydrogen ions in the lumen in exchange for potassium ions, particularly in the distal tubule, in the collecting ducts of the kidney. So when this happens, there will be the loss of the hydrogen ions in the urine. Another cause of the excessive loss of hydrogen ions is through the compensation of the respiratory acidosis. A less common cause or etiology of metabolic alkalosis is the gain in the base. When this happens when we administer sodium bicarbonate to treat metabolic acidosis. So as we all know, sodium bicarbonate is an alkalinizing agent. Another is the administration of organic ions which are metabolized to bicarbonate. Example is citrate in blood transfusions. So the body would normally tend to convert citrate that is present in the blood, blood packs during blood transfusion into bicarbonate. So when this happens, the body would tend to gain more bicarbonate, which is a base, and it could lead to the development of metabolic alkalosis. So what are the clinical signs of metabolic alkalosis? So the clinical signs of metabolic alkalosis are depressed breathing, the breathing that is slow and shallow. There could also be nervous excitement that is characterized by tetany and convulsions and hypertonicity, muscular hypertonicity. So it is said that this condition is much more common in ruminants. So these are the patterns associated with metabolic alkalosis. So in metabolic alkalosis, there is an increase in the pH towards the basic side. For the hydrogen ion change, of course, there's a decrease in the hydrogen ion concentration. The primary disturbance is on the kidney, so there is an increase in the base, increase in the bicarbonate. So the compensation for metabolic acidosis requires the kidneys to excrete the base bicarbonate and retain the acid hydrogen ion or proton. The secondary response would be the function of the lungs, and the lungs would tend to increase the partial pressure of carbon dioxide. So to increase the partial pressure of carbon dioxide, there should be hypoventilation to retain carbon dioxide. For the treatment of metabolic alkalosis, so this includes the treatment of the underlying cause. So for example, the excessive vomiting and the hyperaldosteronism should be treated. And we can also use acidifying solutions such as sodium chloride 0.9% and ammonium chloride 1.9%. We also have the Ringer solution. So the Ringer solution will supply sodium, potassium, calcium and chloride, which are lost or lowered in the case of metabolic alkalosis. Respiratory acidosis involves the retention of carbon dioxide as a consequence of alveolar hypoventilation. It could lead to a decrease in gas exchange in the alveoli and develops when the lungs fail to adequately eliminate carbon dioxide. For the causes of respiratory acidosis, it could be caused by a respiratory obstruction, neuromuscular disorders, and from the use of drugs such as general anesthetics and sedatives, which are respiratory depressants and could lead to the failure to adequately eliminate carbon dioxide. So these are the patterns associated with respiratory acidosis. In terms of the pH, of course, there is a decrease in the pH. For the hydrogen ion concentration, there is an increase in the hydrogen ions. The primary disturbance is on the lungs, so there is an increase in the partial pressure of the carbon dioxide in the arterial blood. And in terms of the secondary response, so this is for the kidney would tend to retain the bicarbonate. In the respiratory acidosis, this is manifested by hypoventilation. So when there is hypoventilation, it will result in the retention of the carbon dioxide, so that there is an increase in the partial pressure of the carbon dioxide in the arterial blood. So when there is an increase in the carbon dioxide, it will combine with water to form the carbonic acid. Then carbonic acid will soon be split into bicarbonate. So that is why there is an increase in the bicarbonate and also an increase in the hydrogen ion concentration. The compensatory response mechanism is for the kidneys to conserve bicarbonate and excrete the hydrogen ions. The clinical signs of respiratory acidosis include respiratory distress, sinus depression with progressive disorientation, weakness, and coma due to carbon dioxide narcosis. For the treatment, initial treatment should be aimed at elimination of the cause. So the administration of the drugs to suppress the respiratory system should be discontinued. So examples of that are the general anesthetics, the barbiturates. Those are the respiratory depressant drugs. We also have the administration of oxygen. So this is beneficial since it is often accompanied by varying degrees of hypoxemia. We also have the contraindication. So the drug or the agent sodium bicarbonate is contraindicated because sodium bicarbonate could lead to an increase in the carbon dioxide in the blood. We also have the respiratory alkalosis. So this develops when the lungs eliminate too much of carbon dioxide. The most common cause of respiratory alkalosis is the overactive positive pressure ventilation during anesthesia. It can also be caused by disturbances in the respiratory system such as asthma, pneumonia, and the pulmonary edema, compensation for primary metabolic acidosis, and any cause of hypoxemia such as congestive heart failure, hypotension, and anemia. These are the patterns associated with respiratory alkalosis. So since there is alkalosis, there is an increase in pH, decrease in hydrogen ions. The primary disturbance is on the lungs. So in the lungs, there is hyperventilation. So it will decrease the partial pressure of carbon dioxide in the lungs. And to compensate, the kidney would excrete bicarbonate and retain hydrogen ions. The clinical signs of respiratory alkalosis include tachypnea, hyperpnea, and CNS stimulation with or without convulsions. So when we say tachypnea, that is an excessively high rate of breathing with the implication that the breathing is shallow, while hyperpnea is an increased minute ventilation. For the treatment of respiratory alkalosis, so this include the identification and correction of the underlying cause, correction of the observed hypocapnia. So when we say hypocapnia, that is a reduction in the partial pressure of carbon dioxide in the blood. We also have the oxygen administration to treat yung hypoxemia associated with this respiratory alkalosis. We also have the administration of analgesics and sedatives. So this is for the treatment of fear, pain, or stress towards the patient. So this is a summary of the patterns associated with simple acid-base disorders. In metabolic acidosis, the primary disturbance is on the kidney, particularly the reduction of the base, the reduction in the bicarbonate. The lungs would tend to compensate by decreasing the PCO2. For metabolic alkalosis, the primary disturbance is on the kidney. There is an increase in the bicarbonate or the base, and the lungs would tend to compensate by increasing the PCO2. For respiratory acidosis, the primary disturbance is on the lungs. The lungs normally would there is an increase in the level of the PCO2, and the kidney would tend to compensate by retaining bicarbonate. For respiratory alkalosis, the primary disturbance is on the lungs. The lungs usually have a lower in the level of the PCO2, and the kidney would tend to compensate by retaining, promoting the excretion of bicarbonate. The slides to follow will examine some cases of acid-base disturbance. So this is the arterial blood gas results from a dog with acute renal failure. So the first thing that we are going to consider in this particular example is we are going first to look into the pH to examine whether there is an acid-base disturbance or not. So the given here are the pH from a dog. The arterial blood pH from a dog is 7.27. We also have the PCO2 of 27 and bicarbonate level of 12. In here, now we have here the reference value that we are going to consider and we are going to compare for our given. So when we are going to compare the pH of the arterial blood gas from this dog with renal failure to the reference value, so we can see here that the normal or the reference value for the ABG, arterial blood gas, should be 7.39. And of course, we have the range of 7.35 to 7.45. So this is considered to be lower than the reference value. So there could be acidemia. So there is an acid-base disturbance present. The next thing that we are going to consider is whether this particular acidosis is metabolic or respiratory in nature. So when we are going to examine the PCO2, when we are going to compare that to the reference value, so it is lower than the reference value. So this must not be a respiratory acidosis, because in the respiratory acidosis, so normally the PCO2 is higher than the reference value. There is too much in the PCO2 in the case of respiratory acidosis. The next is we are going to examine the bicarbonate. So the bicarbonate is lower compared to the reference value. So this must be metabolic acidosis because again, in metabolic acidosis, the primary disturbance is on the base. So the base here is the bicarbonate. So to assess so this is a metabolic acidosis, and in metabolic acidosis, the physiological respiratory compensation should be on the lungs or on the level of the PCO2. So to assess the possibility of a mixed disturbance, it must be determined whether the secondary response is expected. So the observed bicarbonate is 10 milliequivalent per liter lower than the normal. So the normal is 22 and the observed bicarbonate is 12. So 22 minus 12 is 10. So therefore, the observed bicarbonate is 10 milliequivalent per liter lower than the normal. So it is said that a normal dog can lower its PCO2 by 1 mmHg for every 1 milliequivalent per liter decrease in bicarbonate. So since there is a 10 unit decrease in the bicarbonate, so there should also be a 10 unit decrease in the PCO2 in order to compensate for metabolic acidosis. In other words, the lungs, for it to have an expected compensatory response to metabolic acidosis, it should also lower its PCO2 by 10 in order to compensate for the 10 unit decrease in the bicarbonate in the observed data for our dog. So the observed PCO2 is 27 mmHg and the adaptive response is considered to be appropriate because it corresponds to the 10 unit decrease in the bicarbonate in our case. So the patient has a simple metabolic acidosis with appropriate respiratory compensation. We also have here another example of an arterial blood gas results from a dog sick for a week with coughing and dyspnea. So we have here our value for the pH is 7.33, our PCO2 is 57, and our bicarbonate is 29, and these are the reference value. The first thing that we are going to consider is we must ask whether there is an acid-base disturbance or not. So since the pH is lower than the reference value, so we can say that there is. Now, yes, there is an acid-base disturbance, but it is considered to be slight. And this is can be described as a slight acidemia. The next thing that we are going to consider is the origin of this particular acidosis. So whether this is respiratory or metabolic in origin. So when we are going to consider our bicarbonate, so the bicarbonate is high. So since the bicarbonate is higher than the reference value, so this is not metabolic acidosis, no, because in metabolic acidosis, the bicarbonate is usually lower, no, than the normal. So because the PCO2 is higher than the reference value, so we can say that this is a respiratory acidosis in nature. So to assess the possibility of a mixed disturbance, it must be determined whether the secondary response is as expected. So for respiratory acidosis, the respiratory response would be on the bicarbonate or in the kidney. So these are the data that we have now for the metabolic compensation. We have 57 for the PCO2 that is observed over the reference value is 37. So the difference is 20, not 20 units. And for the bicarbonate, we have 29. So 29 is higher by 7 compared to the reference value. So 22 plus 7 is 29. So the difference is 7 milliequivalent per liter. So it is said that the normal dog can increase its bicarbonate by 0.35 milliequivalent per liter for every 1 mmHg increase in the PCO2 in a chronic disturbance. So therefore, the expected bicarbonate should be 29 milliequivalent per liter. So because when we are going to examine our results here, so 57 minus 37 is 20. So there is a 20 unit increase in the PCO2. And it is said that a normal dog can increase its bicarbonate by 0.35 milliequivalent per liter for every 1 mmHg increase in the PCO2 in a chronic disturbance. So since there is 20 unit increase in the PCO2, you're going to multiply that with 0.35 and the result is 10. And therefore, the expected bicarbonate should be 29. So the physiological compensation for respiratory acidosis is appropriate. And the patient has a simple respiratory acidosis with appropriate metabolic compensation for the bicarbonate. So we have here another example of arterial blood gas from a seriously ill dog. So we have here the data of the dog. Now we have here pH of 7.05, 44 for PCO2, and bicarbonate is 12. And these are the reference values. So the first thing that we are going to consider is we are going to look into the pH. So based on the pH, the pH is very low, is lower compared to the reference value. So we can say that there is an acidemia. And the next thing that we are going to look into is whether this particular disturbance is metabolic or respiratory in origin. For the pH, no, there is a severe acidosis because the pH is lower, no, compared to that of the reference value um, by this, no, by this 7.45 compared to 7.39. So medyo malayo yung actual value sa reference value. So, is the acidosis metabolic or respiratory in origin? So, makikita naman natin that the PCO2 is higher compared to the reference value, and for the bicarbonate also, it is lower compared to the reference value. So, the PCO2 is high. PCO2 is higher compared to the reference value, so therefore we can say that this is a type of respiratory acidosis, because in the respiratory acidosis, the PCO2 is higher compared to the, there is an increase now in the PCO2. How about for the bicarbonate? So but the bicarbonate is low as expected for metabolic acidosis. So in metabolic acidosis, there is a loss in bicarbonate. So we can also say that this is a case of metabolic acidosis. So from this data, it can be said that the secondary response is not as expected. If this disorder were a simple metabolic acidosis, the PCO2 would be low in response. So pag ito siya, this is a case of metabolic acidosis, the PCO2 should be lower to compensate for the acidosis. The same is true for pag ito ay naging respiratory acidosis, yung bicarbonate, it should be higher to compensate for the respiratory acidosis. But that is not the case. So this is an example of a mixed metabolic and respiratory acidosis. So we have here another example of the blood gas abnormality. So these are the given, and these are our reference value or normal value. So when we are going to examine the pH, so there is acidosis. When we are going to examine the PaCO2, so the carbon dioxide level is higher compared to the normal. And in terms of the bicarbonate, the bicarbonate is slightly higher compared to the normal. So this is an example of an uncompensated respiratory acidosis. Respiratory acidosis because the PaCO2 value is higher than the normal. And this is not metabolic acidosis because the bicarbonate level is higher compared to the normal. So this is an example of respiratory acidosis. For compensation, or for the normal compensation of the kidney, for 1 mmHg increase in the PaCO2, there should be a 0.35 milliequivalent increase in the bicarbonate. So in this case, there is a 20 unit increase in the PaCO2 versus the normal. So 60 minus 40 is 20 PCO2. We are going to multiply that with 0.35 because we said that for 1 mmHg increase in the PaCO2, there should be a 0.35 milliequivalent increase in the bicarbonate in order to compensate for respiratory acidosis. But in this case, 20 times 0.35 is 7 bicarbonate. So dapat ito siya 24 plus 7. So this should be 31 instead of 27. So 24 plus 7 is equal to 31 milliequivalent per liter. This should be the appropriate compensatory response of the kidney for bicarbonate in order to compensate for respiratory acidosis. That is not the case. Instead of 7, the kidney only compensates 3 unit. no, 24, 25, 26, 27. So tatlo lang yung nadagdag. So that is considered, it is not enough. So this is an example of an uncompensated respiratory acidosis. So we have here another example of a blood gas abnormality. So we have here the normal value and we have here the given. So when we are going to examine the pH, we can see that there is acidosis now because there is a lower pH value compared to the normal level. For the PaCO2, the PaCO2 is considered to be higher by 20 units compared to the normal level. For the bicarbonate, it is also higher by 12 units, 12 units compared to the normal value. So we can say that this is an example of respiratory acidosis and not metabolic acidosis, because in metabolic acidosis, the bicarbonate should be lower than the normal. But in the case of this, this is an example of respiratory acidosis because in this case, the PaCO2 is higher compared to the normal level. So for compensation of bicarbonate, so per 1 mmHg increase in the PaCO2, there should be a 0.35 increase in the bicarbonate. So these are the metabolic compensation. So 60 minus 40 is equal to 20 PaCO2. So the difference between the PaCO2 from the normal and the given is 20. So there is a 20 milliequivalent per liter increase in, or rather 20 mmHg increase in the PaCO2 compared to the normal. So again, our rule of thumb is per 1 mmHg increase in the PaCO2, there should be a 0.35 corresponding increase in the bicarbonate in order for it to be considered as a simple type of acid-base disturbance. So 20 times 0.35 is equal to 7 bicarbonate. So the bicarbonate should be increased by 7. So 24 plus 7 should be 31 milliequivalent per liter. But in this case, it is 36. So it goes beyond our normal value, which is 31. So that this particular type of example is an example of a partially compensated respiratory acidosis. So we have here another example of our example of a blood gas abnormality. So these are our given 7.2, 40, and 15. These are our normal values for pH, PaCO2, and bicarbonate respectively. So of course, this is an example of an acidosis because the pH of the blood is lower than the normal value. And when we are going to examine the PaCO2 and the bicarbonate, of course, we can say that this is an example of metabolic alkalosis, or rather metabolic acidosis, because the bicarbonate is lower than the normal. Now, this is not an example of respiratory acidosis because in respiratory acidosis, the carbon dioxide value should be higher than the normal. And the next thing that we are going to examine is whether the compensation of the lungs is appropriate. So as we can see here, we can say that the lungs did not compensate for metabolic acidosis because the value 40 is the same with the reference value. So when we are going to examine the compensation, the difference between the value, the normal value with the given is 9. That is 9 bicarbonate units. So our rule of thumb for bicarbonate is that per 1 unit decrease in bicarbonate, there should be a 1 unit decrease in PCO2 to compensate for this type of condition, metabolic acidosis. But in this case, since the PaCO2 did not compensate, no, hindi siya nag-move, hindi siya nag-decrease, it should decrease also by 1 unit. So per 1 unit decrease in the bicarbonate, it should also decrease by 1 unit. So instead of 40, to make instead of 40, this should be, so since there is a 9 here, 24 minus 15 is 9, so this should also decrease by 9 also. So since the ratio is 1:1, so this should also be decreased by 9. So 40 minus 9, this should be 31. So since there is no compensation, this is an example of an uncompensated metabolic acidosis.